Welcome to Dr. Alif, your trusted source for senior health information. If you're over 50 and noticing tingling in your feet or blurry vision it, please don't ignore it.
These are not just signs of getting older. Your body may be sending you an urgent warning about blood sugar. Over 37 million Americans have type 2 diabetes picrafling, and nearly half of them don't even know it.
Today, I'm going to show you exactly what happens to your nerves, eyes, and kidneys, and how to protect them.
Type 2 diabetes happens when your body no longer manages blood sugar the way it should.
Think of insulin as a key and your cells as locked doors. In type 2 diabetes, the key stops working. After 50, your muscles shrink, your pancreas slows down, and your cells become less sensitive to insulin. The causes of type 2 diabetes after 50 include diet, inactivity, belly fat, genetics, and even certain medications. White bread, sugary drinks, and processed snacks cause rapid blood sugar spikes that wear down your insulin system over time. Fat stored around the abdomen actively interferes with how your liver and muscles respond to insulin.
Poor sleep raises cortisol for your stress hormone TAPD, and cortisol drives blood sugar up, even if you eat well. If a parent or sibling has type 2 diabetes, your risk is significantly higher. Genetics matters, but it's not destiny.
Some common medications, including steroids and certain blood pressure pills, can raise blood sugar as a side effect. Now that we understand the causes, let me walk you through the symptoms your body uses to ask for help. The earliest signs of type 2 diabetes are easy to miss, but your body is already sending clear signals.
The first sign many people notice is extreme thirst. Drinking water constantly but never feeling fully satisfied.
Unusual fatigue is another early sign, feeling exhausted even after sleeping 8 hours, with no clear reason why.
Slightly blurry vision, especially when reading or looking at screens, can be an early sign that blood sugar is affecting your eyes.
Slow healing of even small cuts or bruises is a warning sign, High blood sugar impairs your body's ability to repair itself. As blood sugar stays high over months, the symptoms become harder to ignore, especially in your feet and hands. Tingling, numbness, or pins and needles in the feet, especially at night, means nerves are already being damaged by high sugar.
Recurring skin infections, urinary tract infections, or yeast infections are a common mid-stage sign trips. High sugar feeds harmful bacteria. Darkening of the skin in folds, like the neck or armpits, called acanthosis nigricans, is a visible sign of insulin resistance. When blood sugar stays high for years, the damage moves beyond symptoms priors. It begins destroying your organs silently. The 3 organs most silently damaged by long-term blood sugar spikes are your nerves, your eyes, and your kidneys. Advanced diabetic eye damage causes dark spots, sudden blurring, or floating shapes in your vision passage, and can lead to permanent blindness. Swelling in the legs and ankles, foamy urine, and rising blood pressure are signs that your kidneys are under serious stress. Foot ulcers that won't heal are one of the most serious advanced signs, and a major reason why diabetes leads to amputation. The good news is catching these signs early and taking action can stop and even reverse much of this damage. If blood sugar spikes go unmanaged for months and years, the damage that builds up inside your body is both serious and wide-ranging.
Diabetic neuropathy starts in the feet and hands and slowly works its way up, causing permanent numbness, burning, or pain.
When you lose feeling in your feet, a small cut or blister can go unnoticed for days and become a serious infected wound. Diabetes is the leading cause of new blindness in American adults, and it happens gradually, with almost no pain until it is too late. Your kidneys filter your blood through millions of tiny vessels, and high blood sugar slowly destroys those filters, year by year. Once kidney function drops below a critical level, dialysis becomes necessary, a life-changing outcome that is largely preventable. Uncontrolled diabetes dramatically increases your risk of heart attack and stroke, the number 1 and number 3 killers in America. Beyond the medical complications, uncontrolled diabetes quietly steals your independence, your mobility, and your quality of life. But here is what I want you to hear, Every single one of these outcomes can be prevented or slowed down significantly.
Let's now talk about what you can actually do at home, starting today, to take back control of your blood sugar.
The first remedy is apple cider vinegar,
1 to 2 tablespoons in water before a meal can significantly reduce blood sugar spikes.
Berberine is a natural plant compound shown in clinical studies to lower blood sugar comparably to some medications. Always consult your doctor first. Ceylon cinnamon, just half a teaspoon daily added to oatmeal or tea, contains compounds that help your cells absorb glucose more effectively. Magnesium deficiency worsens insulin resistance time, and fenugreek seeds soaked overnight can measurably reduce fasting blood sugar. One of the most powerful natural blood sugar tools costs nothing. Here, a brisk 10-minute walk within 30 minutes after every meal. Now let's talk about food pies, because what you eat is one of the most powerful tools you have for controlling blood sugar every single day. Non-starchy vegetables like spinach, broccoli, and kale should fill at least half your plate at every single meal to Kai. Every day. Fatty fish like salmon and sardines are rich in omega-3 fatty acids that reduce inflammation and improve how your body responds to insulin. Now I need to tell you about the foods that are quietly sabotaging your blood sugar. Esheril. Even ones labeled healthy or natural. Lentils, black beans, and chickpeas release glucose slowly tearing. And berries like blueberries are packed with antioxidants that protect your blood vessels. Sugary drinks for sodas, fruit juices, sweetened teas, are the single worst thing for blood sugar because liquid sugar enters your bloodstream almost instantly. White bread, white rice, and regular pasta are stripped of all fiber during processing karan, causing sharp blood sugar spikes within minutes of eating. When you eat matters almost as much as what you eat. Try to eat within a consistent 8 to 10 hour window each day. A simple rule for every meal: half the plate vegetables, 1/4 protein, 1/4 whole grain cross, and never eat until you are completely full. You now have a powerful food strategy. Let's build on that with a complete daily routine that protects your blood sugar around the clock. Quality sleep is non-negotiable for blood sugar control. Aim for 7 to 8 hours every night in a cool, dark, quiet room. Starting your morning with a 20 to 30-minute brisk walk helps burn off overnight blood sugar produced by your liver pooping before the day even begins. Building muscle through gentle strength training 2 to 3 times a week is one of the most powerful long-term strategies for improving insulin sensitivity. Chronic stress raises cortisol and drives blood sugar up gaho. Just 5 minutes of deep belly breathing daily can measurably reduce your cortisol levels. Dehydration concentrates blood sugar. Drinking 6 to 8 glasses of plain water daily is one of the simplest and most overlooked blood sugar tools. Check your feet every single day time. Look for cuts, redness, blisters, or swelling tab, because nerve damage means you may not feel a problem developing. Monitoring your blood sugar as your doctor recommends and keeping a simple log souk gives you and your doctor the information needed to make smart decisions. 2 things that will undo all your efforts: smoking and excessive alcohol. Both severely worsen blood sugar control and all diabetic complications. Never sit for more than 30 to 45 minutes without getting up to move. Even a 2-minute walk to the kitchen resets your blood sugar response. Monitoring your blood sugar as your doctor recommends and keeping a simple log to gives you and your doctor the information needed to make smart decisions. Metformin is usually the first medication prescribed for type 2 diabetes. It works by reducing the amount of glucose your liver releases into your blood. Your A1C test gives a 3-month average of your blood sugar. Aim to have it checked every 3 to 6 months and target below 7%. Newer medications like SGLT2 inhibitors and GLP-1 receptor agonists not only lower blood sugar, they also protect the heart and kidneys directly. At your annual checkup, request these tests: kidney function, urine albumin, cholesterol, eye exam, foot exam, and thyroid function. Managing diabetes well is a team effort. Your primary doctor, a dietitian, an eye doctor, a podiatrist, and if your doctor recommends insulin, please do not be afraid to hide. Insulin is a powerful tool that protects your organs when other medications are no longer enough. Know these emergency signs: blood sugar over 300, fruity breath with confusion, or sudden chest pain. Go to the emergency room immediately. Managing type 2 diabetes is a long-term commitment, but every single month of good control adds years of healthy, active, independent life. Before I close, I want to leave you with something important. Something I want every person watching this to truly hear and believe. Low blood sugar, below 70 milligrams, with confusion or shaking also needs emergency attention. Always carry a fast sugar source with you. Managing type 2 diabetes after 50 is absolutely possible. Millions of people are living full, active, healthy lives. You protect your eyes back, your ability to see the faces of the people you love, to read, to drive, to stay independent. You protect your kidneys, keeping them filtering cleanly so you never have to know what dialysis feels like. When you take care of your blood sugar, you protect your nerves.
You protect your ability to walk, to feel, to move freely.
Every healthy meal, every walk after dinner, every good night of sleep, every doctor's visit time, these small choices add up to a very big difference.
This video is for educational purposes only and is not a substitute for professional medical advice. Always consult your personal doctor before making any changes. And I want you to hear this clearly, Pack. It is never too late. Whatever your age, whatever your current numbers pew, before you go 10, I want to share one more thing that most doctors do not spend enough time explaining: how your sleep directly controls your blood sugar overnight. Between 3 and 8 a.m., your body releases hormones that push blood sugar up, even if you ate nothing. This is called the dawn phenomenon. New research shows your gut bacteria directly influence how your body processes glucose. A healthy gut microbiome may actually improve insulin sensitivity. Every time you feel stressed, whether from news, family, finances, or pain, your body releases cortisol, which pushes blood sugar up within minutes.
Adding fermented foods to your diet, plain yogurt, kefir, kimchi, or sauerkraut.
Sugar hides under more than 60 different names on food labels, including maltose, dextrose, evaporated cane juice, and high fructose corn syrup. Glycemic index ranks foods by how fast they raise blood sugar. Low glycemic foods are your allies. High glycemic foods are your blood sugar's worst enemy. A quick reminder, Ty, if you take only one natural remedy from today's video, let it be this: 1 tablespoon of apple cider vinegar in water before your largest meal of the day.
Including a source of protein at every meal. Eggs, fish, beans, or Greek yogurt hap.
I would love to hear from you, Kad. Tell me in the comments, what symptom first made you pay attention to your blood sugar? Your story might help someone else. If this video helped you or someone you love, please like it, share it, and subscribe, pros, so we can keep bringing you trusted health information every week. Stay healthy, stay informed, and remember, Toast, every good decision you make today is a gift you are giving to your future self. And if you want to know exactly which foods spike blood sugar the fastest in people over 50, watch our next video right here. I will see you there.